Another question that we got was a very good question on pelvic floor dysfunction in women. Men also get pelvic floor dysfunction, but the symptoms would be different. The issues are quite different, and it's much less common, particularly in women who have given birth. Then pelvic floor disorders are much higher. In women who have given birth twice, the rate of pelvic floor dysfunction is about 80%. Now, those are women that are actually going for treatment, talking to someone about it. So it may be higher, and a certain number of women just don't talk about it. So it's a big deal. And because it's a big deal, at some future date, depends on what happens in the world over the next week, whether I cover it next week, but at some fairly close in date, I'm going to talk about pelvic floor disorders. And the reason I'm not going to do it now is because there's so much to talk about. Pelvic floor disorders can be muscular. They can be structural. The bones aren't in the right place. Again, that's usually after giving birth. It can be neurological. It can be stress-induced. And the number of treatments is huge, a huge number of very effective treatments. One of the things that we've been doing a lot more of lately, and this isn't always classified under the category of pelvic floor disorders, but we're dealing with a lot of bladder issues, and particularly issues of bladder control and or urgency. And there we're doing techniques to stimulate the tibial nerves and the ankles. And this is something that there's a tremendous amount. I've seen 4 studies actually done treating those tibial points to treat urinary problems. And in the patients that we've seen for this problem, we have a 100% improvement rate. Now, sometimes it's 100% improvement, sometimes it's 40 or 50, but every woman that we've done this with has had some improvement. It's a very powerful, incredibly easy technique. And then after a certain number of treatments, I will teach these women how to do self-treatments to kind of stay in good shape afterwards. And so because it's so complex in terms of diagnostics, in terms of potential treatments, I want to actually give it enough time to really talk about it in detail.